you everyone for attending. Thank you, Amara, for the wonderful introduction. And I'm just going to hop into it here. When we were preparing the slides, really, I know Arlene had sent that it would be quite a broad audience. So making sure that we're, I guess, setting a sort of standard of who knows what about Vancouver Coastal and about the organization. Just wanted to show the slide to show the breadth of what we do. And today I'm actually going to be speaking more about the analytics team here at VCH, the culture and the journey that we've been on in really building a strong team to support the pandemic and beyond. And so rather than get into all of the technical details around how we support this level of activity and volume of service, I'm going to really speak more from the perspective of how we've managed to, through the pandemic, build a very strong team that's flexible and responsive to the needs of the evolving healthcare system, both from a quality and efficiency and accountability perspective, all of those things. So that's really going to be more the focus. I figured that a lot of the other presenters would be focusing more on the Tableau dashboards, some of the brass tacks products, the modeling or reporting that comes out. And so I haven't included that. I've included a slightly different perspective in terms of our journey and how the team has come together. So what do we do at a very high level? This is essentially a different way of viewing the sort of knowledge wisdom continuum that I recall being taught all the way going back to undergrad at UVic. And really it's about how we synthesize information and data into insight. And you'll see that as a common thread across here. Across all of the slides that I have here and what I'm going to speak to, because it really is around that storytelling and how we work with our partners, as we're not the core mechanism in the healthcare system. We're not frontline providers. We're not physicians, nurses, occupational therapists, etc. And so how do we best lend our insight when we're not the core within the system? So if you think about it from an analytics standpoint, this is very different than an Amazon, or as even more so some of the tech firms like Facebook or Google, where the core engine of things really is around the analytical teams and analytics and data. And in fact, with Google and Facebook in particular, data is the commodity that they're using in order to do their work, and what they're essentially selling when it comes to marketing data, etc. Whereas in healthcare, more similarly to other industries, whether it be in food production or whether it's in supply chain or other things, where we're not the core engine of the organization, we're a supporting service. And that's reflected in the name decision support. So our job essentially is to help the organization provide quality care, quality and efficient care, using data as a way to work in partnership with the frontline providers, managers, and decision makers who are making those core decisions every day around care and how it's delivered. That being said, taking a look at the wider landscape, we have a lot of different people who we work with, both internally and externally as stakeholder groups. And I imagine a lot of you recognize like CIHI, etc. There's a lot of different lenses on the data. There's a lot of data going to different places, and it needs to be rolled up and sliced in different ways in order to fulfill all these purposes. So that's really what is more seen and what I can describe to all of you. Behind the scenes, there's a lot going on that is not really exposed outside the walls of the department. And a lot of what we learn about as informatics professionals. And it comes down to data quality, the fact that there's over 2 billion records that we're managing, several thousand tables, and these numbers are probably out of date right now because it fluctuates so much given the breadth and the size of what we're managing in our data holdings. And it starts to become actually more like processing signals or large data sets where we're not able to pop it open in an Excel sheet or to look at it in a static way because the data set is so large, or the data set is so real time, which is the other advent that's happened recently, that it's impossible to really look at a static snapshot in a meaningful way from a data quality standpoint. So what's below the ground here in terms of the tree is massive. And there's all sorts of different technologies you see on the right, whether or not we're using data visualization, which is our tool, Denodo, Oracle, some of the standard tools like Oracle, SQL, Tableau that you've probably heard of through VADA or beyond, and the number of tests, the amount of testing and deployment that we have to do, it's absolutely vast. And so it's been quite an interesting journey through this. I've been working in the analytics, the healthcare analytics realm for over 20 years now. And that was when it wasn't even called analytics, and it was more just business intelligence and OLAP and cubes and some of the very nascent technologies that have moved us more towards what we now collectively call data science and advanced analytics. So over that time, it really has grown from an offshoot of information management to something way more complex. And in that time, and I'll talk about this, as I said, in really framing this more in the journey of the team and the development of the space. In that time, it's grown from a handful of individuals to now what I'm describing here, including the recent pieces of information and teams that we've onboarded, around 140 analytics professionals. So that's been very different in terms of a journey than what we were doing off the side of our desk before from a management reporting function and early BI technology. The way we're structured as a result, and this has changed over the years, has been a look at the technical infrastructure and having teams maintain all of that I described on the previous slide. There also is a team that looks at requirement development and how we bring, say, a new field into our data holdings, which is different than the two boxes on the right around system improvement, which is really where the rubber hits the road. I'll describe that a little bit more, but essentially that is taking the data out, synthesizing it, working with our operations and regional stakeholders in order to get a meaningful story and meaningful decisions made out of the data that we hold. The key enablers are in the box in the bottom. And really a lot of the work that we do, I mean, I could go on for hours and hours and hours showing the products themselves. And as I said, I'm not going to focus on that as much as the journey of the team and some of the success factors we've seen in doing the work. So along the way, part of what has been interesting is originally there was a focus externally. So if you think about a team of about a dozen, 10 to 12, say, the team at that time was built of specific SMEs. And so someone would be, for instance, one of the team members would be an expert in long-term care, or one would be an expert in surgery, etc. And there really wasn't a lot of internal process because at that sort of size, it's not really that necessary. With 10 to 12 people, it's possible to have informal communication and to really connect on a more relational basis, one-on-one or small groups, and really know what each other are doing, and it's fairly straightforward to manage. Of course, it has the downside of when somebody is away or someone is sick, it's not so straightforward to cover. If that person is an SME and a subject matter expert, sorry, I should not use so many acronyms, in a certain area, then, you know, like that's the downside of the team at that size. I remember very distinctly at one point, as the team was growing, there was a report that went to the board around some bed savings, which I hadn't seen because as we were growing, we hadn't caught enough necessarily internally around how we were managing things. And so as it grows, as we're growing to sizes of 25, 30 plus, et cetera, there's some of these growing pains along the way. And one of the big ones is really shifting to focusing on internal process and thinking about the analytics team as an actual operation unto itself, as opposed to supporting and having a group of SMEs that support others across the rather large organization here that you saw at Vancouver Coastal Health. And so I remember the COO at the time pulling me into her office and saying, how have you not seen this report that went to the board? It said there were, I don't even remember, 23 beds saved. And when I asked you, you hadn't seen it. And I was, of course, shocked. And it was a really strong learning moment, though, because at that exact moment, I realized that my job now is not to look at methodology and look at each piece of technical or mechanical work going out, but to have processes in place so that I'm seeing what I need to see, and that somebody else perhaps is looking at other things, but there's structure in place internally. And that was really the ask from that meeting. Was at that point, the COO asked, all right, well, you need a way to understand what work is going on and how it's being reviewed. So please get back to me about how you're planning on doing that. I happened to, at that time, know someone who worked in the private sector, and interesting fellow who is a consultant to startups. And startups go through a lot of growing pains that are similar to this. And in a lot of ways, the way that we view ourselves in decision support here at VCH is kind of like a startup in a public sector organization, because we've really had to build the whole function from nothing over what is quite a long time, but in the grand scheme of things, not too long. And we sat down for a beer, and he said to me, look, this beer is how much capacity you have. You need to know how much work you're taking on, how full the glass is, and you need to know what's spilling over. And at that point, I sort of realized, well, that is the crux of it. That really is our accountability, not only to the organization, but to the taxpayer around understanding how we know that we're doing a good job and we're really spending resources in a way that is adding value, because that understanding that full work in flight is critically important. And so at that point, and since then, part of what we've done is put together a model internally around how to build an analytics team. And this is not talked about as much. I think in part because it's fairly rare actually for a team to be this large and consolidated. There's been a lot of work over the years in creating an opportunity for the team to come together and to centralize the function more and more so. And so at this point, as I mentioned, we're about 140 analytics professionals. And that, as you'll see later, is a diverse, very, very diverse group. And so our model really has centralized since that time and that meeting that I had with the COO around people, process, and insight. And although this looks like just a conceptual model, we've implemented tools against each of these boxes. And so I'll describe each of those. This is really important because in my experience, growing a team, especially as it comes to analytics, over about 24, 25 people, it starts to really need this kind of deliverance around what the internal model and function of the team is going to look like. So the base of the pyramid really is around people. And at the time, in order to grow sustainably, we had to really shift our thinking around what the overall complement of analytics professional look like in the department. And over the years have had recruited people from very diverse backgrounds, including HR, someone with an HR background, finance, other areas, and have more recently even seen some of our staff move on in ways that we hadn't seen before. One is moving on to become a midwife. One had a background and has a background rather in data development and IT development and is now a counselor. And so the reason why that is because the recruitment box here, we really changed to focus on looking for potential rather than looking for pre-existing technical skill sets. Now, of course, it's best if we're able to find both, but we can't always guarantee that. And we realize we're getting to a size large enough that we're able to have our own training and onboarding, which is the second box there, and standard work around onboarding so that we're able to then take it to the next level and bring in a very diverse workforce. In doing so, we also have a formal succession planning process in order to really be deliberate about talent management. And layered upon all of this is the next box up around process. And we have standard Agile workflow, huddles and scrums and scrum master roles, and standardization of how all the work is loaded onto the boards and managed. So there's thousands and thousands of stories moving every day to support all of the work that I described earlier. So all of this is meant really to facilitate, and in the case of the process piece, really free up time in order to allow us to add insight and innovation. Do we always get there? No, but this has been a model that has worked as we've grown now to quite a large size. Sorry, so this, I'm not going to go into everything here. This shows the breadth of skill set that we have within the group. And so we have everything from hardcore development skill sets to nursing and everything in between. So like a lot of different overlaps and really celebrating the uniqueness and what each person brings to the team. What has been really interesting is bringing on a clinical skill set in an analytics team, and something that has been really valuable, especially as it comes to seeing things from a quality lens. Something that I can't emphasize enough, and I'm also right now, I'm at an acute site, I'm at Vancouver General Hospital, is part of our journey has been having an on-site presence. And so I remember even during the pandemic, I was asked by some of the leaders here at Vancouver General Hospital if I would be in on the weekend. And as much as that is a lot of pressure, it also, I'm very grateful that we are now at this point in our journey seen as a crucial part of operations, whether it's community or whether it's at like a community health center or within the acute hospitals. It's easier within the acute side. And so at each of the major acute sites, Lionsgate, Richmond, and Vancouver General, within Vancouver Coastal, we have on-site offices and a very distinct and productive collaboration with our operations stakeholders right up to the COO. And so that really makes a difference in terms of analytics and applied analytics, and having the context to understand what we're analyzing and what insight we should be providing, and also working with our partners so that they can better understand what we're producing and use it in a more meaningful way to make real-time decisions. So I know Martin talked about COVID data a lot. A lot of the information that was presented there, we have at a more detailed level for the health authority. We also have much more detail in terms of some of what I'll describe in a second, operational reporting. But as I said, rather than focus on the reporting itself, really looking at some of the success factors in terms of our journey and how we've managed to bring the teams together throughout the pandemic. And so with that middle box, with the process piece, the first thing that we did when the pandemic hit, and if I recall correctly, it was when the NBA shut down their season, that seemed to be the pivot point when everyone started really noticing that there's a potential, there is a pandemic with COVID. And so what we did was we stood up a COVID Agile board, and we loaded it as a cross-functional team, pulled a Scrum Master in. So, I mean, you can look up Agile methodology if you're interested. The bottom line is we have all the process and structure within the department to do these things really quickly. And so you see on the right, depicting basically what we're doing. It was all virtual. We're using software, a piece of software called Jira in order to run our Agile teams and run our Agile boards. And so that happened very quickly. And the big success factor there was around just the clarity everyone has in the process and how to communicate through what is rather complex work. So I've covered a lot of this. That really, the agility in Agile is something that is often hard to walk the walk on. With so many disparate sources of data across, in order to do all the COVID reporting, we really had to engage a variety of stakeholder groups. And so what we did was we used our data virtualization environment where we can load different data sources into our technical infrastructure in order to create that integration engine very quickly to produce the COVID reporting that was required internally in submission to the province. And as I mentioned, the on-site presence really was critical because we engaged directly with our stakeholders for the expertise, and in some cases, going right to some of the COVID physicians who have administrative duties as well, and doing that initial validation of how many patients are on the unit right now. Because with the reconfiguration of the hospitals, our traditional data sources weren't necessarily accurate until we adjusted everything. And so it was really, really chaotic in terms of trying to understand how we should best support the organization through the pandemic. And with all of what we considered normal from a data perspective in terms of standards and definitions shifting at the same time, and having to create new ones around how we characterize the data so that we're confident that what is being reported is accurate under extreme pressure where, as you all know, we were reporting every single day. I've never seen it before. I've never seen anything that intense. It really stretched the breadth of the team as well. And what was a huge success factor was, for instance, having nurses on the team who can do the clinical review to understand if a COVID case, and to look at the evolving comorbidity picture as the data started to roll out. So there's just a lot going on. And there's no way that we could do it without having the structure and the right recruitment and looking for the right things and how we build the team up. Actually, because we're also used to working remotely, something that we had moved through previously. And what you see really, a lot of the publicly available stuff, even what Martin showed, is really the tip of the iceberg. At one point, we even had to adjust the, we were working with a small vendor in terms of scheduling vaccination, and we actually had to write a bot in order to log into the system 16 times simultaneously and extract data using some automation, where you could actually see it picking things off the screen and copying it and then loading it into a file. So sometimes it's not the sleekest solution, but it definitely is finding the team and building the team that will do whatever it takes in order to make the work happen. And that's how you saw the reporting happen every day. So just in summary, this is a lot of really what I wanted to impart around our working model, people, process, and insight, the breadth of service we provide, really partnership and breaking down silos, being a knowledge bridge for the organization, and the flexibility and partnership that we bring to the organization in how expansive our knowledge is across the continuum of care.